Hello, my name is Joao Cavalcante. I'm from Cleveland Clinic, and I'm reporting here as part of the FITs on the Go blog, and I'm here with Dr. Michael Lincoff from also Cleveland Clinic. I have a pleasure to have here with me, and I was going to ask Dr. Lincoff to have some of these insights on, for fellows that are graduating, what would be some advices or things that he would suggest to start a research career, being an academician, a clinician academician?
Well, most of my experience has been with industry-sponsored trials and rather than federally funded. So, most of what I would look for in developing a career would be to begin to be involved in research as a fellow in research that's happening at your site, and to begin to get to be known by the industry sponsors as someone who's productive and works hard on the studies. And then as you move out on your own, as the opportunities come for trials to be a site at a trial, to carefully choose which trials you become involved in, to focus on trials that you think you could be successful. Because there's nothing that's more interesting to a sponsor or to an investigative center, an academic research organization, is a site that performs well, where the principal investigator or the sub-investigators really enroll a lot of patients, carry out the study with good quality. And so that's how you start to get known, and then you get invited to be involved in other studies and invited to be on advisory boards. And so, but I think one of the key things, especially if you're going to center that doesn't already have an academic research organization like Duke or like Cleveland, but you're trying to forge the links yourself, is to establish these relationships by carefully choosing what you do and performing very well in which studies you get involved in.
Terrific. I think that's a great advice, and I think having the experience of building up on trials and recruiting patients is critical. And advices on how to better address those issues nowadays. Recruiting patients into American trials or American-based trials is more difficult. Any things that we should try to learn from these lessons?
Yeah, you're absolutely right. The regulatory environment and the financial environment has made it very much more difficult to bring patients into trials. I think of the many lessons, the most important one is to pick the trial carefully from the standpoint of feasibility. And we've tried to extend an infrastructure to do that within the Cleveland Clinic as well. And there are all kinds of checklists, et cetera. But the key points are, do you really have the patients? And that might even involve doing what we call mock screening for a couple of weeks to see, given the inclusion criteria, are you really going to have those patients before you start spending all the money to submit to the IRBs and to do all the other regulatory events that cost money and cost time. Look at the inclusion criteria. Can you do it? Look at the equipment. Do you really have that equipment? If it's a study that involves having a 3D echo in an operating room and you don't keep a 3D echo machine in the operating room, then it's probably not something you can do. Do you have the expertise? Do you have colleagues who are willing to enroll patients who would actually be interested? The best performing centers are the centers where a group of colleagues, of physicians, of partners get together and say, these are the trials we consider high priority, and we're all going to work together and do these, and we're not going to spread our efforts about a bunch of different ones. So it's really an issue of, I think, careful selection and then careful assessment of what your costs would be, so you don't end up with budgets that you lose money on.
Terrific. I think these are great advices, and I'm happy to report here to the FITs on the Go.